Hi, my name is Dr. Rudra Mohan and today we're going to be talking about mandibular advancement devices for obstructive sleep apnea. Let's start. So I've already created an episode where I've covered most of the pathogenesis or the pathophysiology of how obstructive sleep apnea works. It is basically the duration of absence or reduced breathing and saturation of the oxygen in your body while you're sleeping because of various causes. That could be anatomical, that could be obesity, metabolic, anything under the sun which leads to this whole syndrome known as obstructive sleep apnea. Now, because of the obstructive sleep apnea, you have a lot of lifestyle quality of life related problems such as increased hypertension, more susceptibility to metabolic syndrome, more susceptibility to cardiovascular complications. And that is why in today's day and age where most of the people are not leading such great lifestyles, not getting the proper sleep, and at the same time having obstructive sleep apnea, it is always better to get yourself checked out for a sleep apnea study where they will tell you what your apnea hypopnea index is. The reference range has been given, and depending upon the diagnosis and also the interpretation of the results with the help of a sleep specialist, you can get the various treatment modalities. If it's severe sleep apnea, you might have to go for CPAP or BiPAP machines, which is positive airway pressure machines. But if you have mild to moderate sleep apnea, you can go for some device known as mandibular advancement device, and I'm going to be talking about it today. Now, mandibular advancement device, as the word says, as the sentence says, mandible is your lower jaw, advancement is the advancement, and the device is the device. Basically, what happens is when you're having a sleep apnea episode, most of your muscles and everything, they go relaxed and then they collapse. Right from your tongue, which can fall back, the roof of the mouth, the back of the throat, and your pharyngeal wall, which is known as pharyngeal collapsibility, thereby reducing the number or the volume of air that can go inside your lungs for respiration while you're sleeping, and that's where the problem happens. You can get reduced oxygen saturation, you can get reduced breathing, which is known as hypopnea, and you can also get something known as apnea. That means your sleep apnea is something where your breath immediately stops or cessates for some time, and that's where your medulla oblongata in the brain, which is the most vital organ in the brain, helps you basically to wake you up. And that's where your sleep cycle, your REM sleep does not happen, and so many things that happen, that your sleep waves, alpha waves, theta waves, they're all disturbed, and then you end up having symptoms in the day. The symptoms being that you have stuff like tiredness, you have daytime sleepiness, you don't feel energetic, there's lack of concentration, hyper irritability, and so on and so forth. So mandibular advancement devices is usually given for cases of mild to moderate obstructive sleep apnea, where you have monoblock devices and you can have customized mandibular advancement devices where thereby you can just place them in your mouth, and as per the instructions of the manufacturer and your sleep specialist and the dentist, you can advance the mandible with the titration, and then the mandible will come forward, your tongue will fall into the jaw, and the volume of the area will increase. Not only that, just the lateral walls of your throat will also open up, thereby increasing the amount of oxygen and air that is going inside your body and not waking you up, decreasing the AHI, that is the apnea hypopnea index, and it has been shown to be found very significant in studies when it is compared to placebos or control groups. Now, I have to be very honest, if you have severe obstructive sleep apnea, it is always better for you to go to a sleep specialist, and if they are highly recommending you go for a CPAP or a BiPAP machine, please do not try to argue with the sleep specialist, because they know what's in the best interest for you, and try to get your hands on this CPAP or the BiPAP machines. Now, I understand that they are very expensive and they are very bulky and they cause a lot of side effects, including discomfort while you're getting acclimatized to the machine. But the same things also go for the mandibular advancement device, because it takes usually about 6 to 10 weeks for you to get acclimatized. You might have some side effects such as excess salivation, you might have jaw tenderness, tooth tenderness, for which you need to make sure that you are going to visit your dentist regularly for getting yourself evaluated. And on top of that, you need to get your obstructive sleep apnea or sleep apnea study done regularly to see what are the epochs and what are the times that you're having apneic episodes or hypopneic episodes, how your saturation is working, because of the fact that also it's been found that mandibular advancement devices have shown to decrease the blood pressure that you have during the day because of the fact that your oxygenation is better during the night. However, all this being said, I would strongly recommend, if you have severe obstructive sleep apnea, please get in touch with your sleep specialist and please comply with what they're saying. You have to understand that your sleep has to be very good. It is one of the most important vitality functions for your age. Everything else is related to your sleep in the body in terms of health and disease. So it's absolutely necessary that you comply with what your sleep specialist has told you. So this was today's episode. Please like, share, subscribe, and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles. Kindly refrain from calling me directly as I might be busy with patients. Just drop me a message on WhatsApp with your name, your location, and the common oral health problem that's giving you discomfort, and drop me a message. I'll respond to you within a couple of days. I can't promise if I can do it on the same day. And if you have any queries, doubts, apprehensions, or insights, please feel free to put them in the YouTube comment section. So that's it for today. Thank you.